Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about therapeutic communication, about the techniques of therapeutic communication, and also about the obstacles of therapeutic communication. So I guess by now you guys have a detailed idea of what therapeutic communication is, right? You all know that therapeutic communication is a communication that occurs between the healthcare professionals and the patient in order to advance the emotional as well as the physical well-being of the client. So here in this therapeutic communication, there are 4 phases of therapeutic communication. So these 4 phases are: the first one, that is the pre-interaction phase; the second one is the introductory or the orientation phase; the third is the working phase; and the fourth one is the termination phase. So let us look at each phase in detail. So the first one here is the pre-interaction phase. So what do you mean by this? Pre-interaction phase is a phase which a nurse goes through before her actual interaction with the client. So here what happens is that a nurse will be assigned with a client. Okay, suppose I am the nurse, I will be assigned with one client. So the phase whereby I haven't met the client yet, but I have just got a little information about the client, I've got an idea that I am the one who's supposed to treat the client. This phase is known as an interaction phase. So as I've said, right, that this is a phase before the actual interaction with the client. So it means this is the time period from when you have gotten information that you are going to be the one who will be taking care of that particular client, but still has not met that client yet. Then here what happens is that in this phase you will have to plan for how to develop a therapeutic communication with the other client. So in order to ensure that you develop and you maintain a good therapeutic communication for the client, what happens is that in this phase you will be preparing yourself for encountering the client. Like, what will you talk about when you meet him? What are the various information you should collect from the client as soon as you meet the client? So this is what pre-interaction phase is all about. Again, let me summarize. This pre-interaction phase is the one which starts from when you are assigned with a patient but have not yet met them. So during this phase, what happens is that you will be preparing yourself about the questions or whatever information you need to gather from your patient. So what are the tasks which will be involved in this pre-interaction phase? Here, the first task is that obtaining available information about the client from their charge, significant others, or from the other healthcare team members. So here, as I've said, that this is a phase when you will know that you will get an idea that you're assigned with this patient, but you have not yet met them. So what happens is that here, before you meet them, you'll try to obtain all the necessary information about the client, be it from their charts or be it from the other healthcare team members, or also from their significant others. From this information, the initial assessment begins. So here, even though you have not met the client, even though you don't really know much about the client, but these simple information which you can gather from their charts or from the other healthcare team members can also help you in gaining some knowledge about the client. And it also serves as an initial assessment. Why? Because here you'll be getting some idea about what that person is or what is his disease condition. Okay, and the next one here is that the initial information may allow the nurse to become aware of the personal response to the knowledge about the client. So here what happens is that these initial information which you also receive from their charts or from the other healthcare team members, it makes you aware of the client. It gives you an idea of how the client will be or what is the condition of the client. It also examines one's feelings, fears, and anxieties about working with a particular client. So here what happens is that as a nurse, you will have to encounter different types of people who has different attitudes, who have different beliefs, who are from different backgrounds. So we cannot expect everyone to be the same. We cannot expect everybody to be polite, or we cannot expect everybody to like us or to accept us, or even to always cooperate with us. So here, initially in this phase, because you haven't encountered the patient yet, you'll only be getting information from others. So sometimes it happens that as a nurse, you may be anxious, or even sometimes you may be scared, or you may have a mixed emotion about that particular person. The most important thing that you need to do in this phase is to set an objective for the client. So here, as soon as you get the information about the client, as soon as you know the condition of the client, what you can do is you can start setting objectives, start setting goals, what you need to do for the client in order to help them regain back their health as early as possible. And you here as a nurse, if you feel like you're anxious, you're scared or uneasy, to encounter that patient or to provide treatment to that particular client, then what you can do is you can take the help of the supervisor or your co-workers to help you reduce your fears. So these are the various tasks that you should perform in this pre-interaction phase. However, there are certain reactions of a nurse that may occur in this pre-interaction phase. The first one is that whatever the nurse may think or feel about that particular patient before the interaction depends on her fears, misconception, as well as her knowledge. So as I've said, that this is a phase whereby you'll only be getting information about the client, but you have not even seen the client, nor have you talked to that particular client. So what happens is that whatever you think about the client or whatever you feel towards the client will only depend on your knowledge, misconception, as well as fear. What also happens in this phase is that sometimes because of this fear, because of this anxiousness, that you don't really have enough information about the client, then the nurse will try to collect all the information about the client from the secondary sources like their charts or from a resource person, as well as from the nurse who was taking care of that particular client. So because here as a nurse, since you don't have much knowledge about the client, since you may not get all the information you want about the client, what may happen is that you may try to get these informations from their charts or from the other nurse as well as from a resource person. So after she has collected all these required information, the next thing she is going to do is she is going to plan how she will be interacting with the client as soon as she encounter that particular client. She is also going to plan what are the things she need to achieve from this interaction, as well as how she is going to help the particular client. After all of these, she'll also plan her objective for this interaction phase. So usually what happens is that you didn't encounter your client, you've just gotten information from the chart, from resource person, from the other nurse, and sometimes you may feel that no, this information cannot be valid, or somebody might say something else whereas their record shows something else, so you may feel anxious. Okay, but you can reduce this anxiousness, this fear, by preparing yourself on how you will be communicating with that particular client when you encounter them, preparing all the necessary questions for which you strive to achieve an answer, and also set a clear defined objective for this interaction. So through this, you will be able to reduce your anxiousness, as well as you will be able to motivate yourself, as well as find all the necessary things which is required in order for you to complete it at the first interaction itself, rather than thinking, what will the patient talk to me? What will be their behavior? Will he be aggressive? Will he communicate properly? Instead of thinking about all of these, if you only think about the positive side, then this communication will be an effective one. So this is all about the pre-interaction phase. So moving on to the second phase, that is the introductory or the orientation phase. So as I've said, that in pre-interaction phase, it is the phase whereby the nurse will be getting information that this is your particular client for whom you have to take care of, but have not yet encountered the client. In this introductory phase, what happens is that you will be the one who will be going to the client, who will be initiating the conversation. So here, as you know encounter the client for the first time, the first and foremost thing you need to do is introduce yourself, as well as get an introduction about the client. So through this way, you two will be getting acquainted to each other, and it is also in this phase whereby you will be getting a chance to obtain all the required information about the client. And this phase will end when the nurse and the patient are fully acquainted towards each other, when they feel comfortable, and when they have shared all the information which the nurse wanted from the patient, as well as which the patient wanted from the nurse. This phase will also come to an end as soon as the nurse and the patient accept each other as a unique individual. So here, now we will look on what are the various tasks of an introductory, or also known as the orientation phase. The first task is establishment of contact. So here, as soon as you encounter the patient, the first thing you must do is you must introduce yourself. You must try to get an introduction from the patient. You must try to get all the information required. And in this process, you must also try to build trust and rapport by demonstrating acceptance, interest, as well as establishing a therapeutic environment, ensuring safety and privacy of the client. So this phase is a very important phase, because it depends on how you carry yourself, on how you perform the task in this phase, that would lead to a effective or an ineffective therapeutic communication. If you are not able to introduce yourself in a good manner, or if you are not able to gather all the information required in this phase itself, then later on this can serve as a problem, since for providing any treatment, it is very necessary that you get a detailed information about the client. The next is making an agreement or pact. So as we have discussed in the previous session about therapeutic communication, we have come to know that this therapeutic communication must only start and end in the hospital setting itself. This therapeutic communication must not be continued in case the person has already left the hospital. So what happens is that during their hospital stay, they may find an attachment with you, or they may feel that they have become so close to you. So in order to prevent any misunderstanding, you must make it clear from the very beginning that this therapeutic communication will only start and end in the hospital setting itself. And you should also make it clear that whatever you are doing for them, it is because it is your duty to do so, and not that you're doing it because of your personal interests. The next one is talking with the patient. So as I've said, in this introductory phase, you will be having an interaction as well as a communication with the client. This is the phase whereby you can collect all the information required for the client. This is also a phase whereby you will be providing them information about the treatment they require, or the various things they need to do and they need to follow in order to help them promote their health. So whenever you talk to the patient, in order to ensure that they listen to you, they follow you, you must first try to build a trust in them. So as soon as the person start trusting you, as soon as the person feels that you are honest, then only this communication will be effective, then only this relationship will be effective. Why? Because if they have a trust in you, then they will be able to self-disclose themselves, no matter what situation they are in, or no matter what feelings or emotions they are going through. Not only that, but through this, you will also be able to obtain all the correct information about the client. Because here what happens sometimes is that the client will be prepared with the answers that you are going to ask them about. So what happens is that when they have already prepared an answer, even if you try to ask them, they'll not tell you the correct one, whereas they'll tell you the ones which they've already prepared with. But here, if you are able to develop a good relationship, if you are able to have a good interaction with the client, then here they'll be very honest towards you. Why? Because they trust you. So here it is very important that as a nurse you must build a trust in them so that this communication will be an effective one. It is also in this introductory phase that you need to assess the client needs, the coping strategies, the defense mechanism, as well as their strength and weakness. So here we have come to the end of this introductory phase. So in the introductory phase, I've said it is a phase which will start from when you have encountered the client. It is also a phase whereby you will start introducing yourself and get an introduction from the client. This is also a phase whereby you will gather all the information about the client as well as assessing their needs, their defense mechanism, as well as their strength and weakness. The third phase here is the working phase. So when does this phase start? This phase usually starts if the patient and the nurse had already overcome the orientation or the introductory phase. So as soon as the nurse and the patient gets comfortable with each other, as soon as they start trusting each other, then only this working phase will start. So what happens in this phase is that after the patient had become comfortable with the nurse, after the patient, has started sharing everything, be it their emotion, their feelings, or the pain which they are going through, then what happens is that the nurse and the patient will start working towards achieving their goals which they have made in the orientation phase. So here now, for example, if a patient had come to the hospital because he was not well, he was having pain. So what happens is that in the introductory phase itself, when you will be gathering the information about the client, you will be stating that, okay, you're having pain, so for this we are going to do this. You're going to take this medication. Why? Because this medication will help you relieve from pain. Or we are going to perform this procedure so that you will be relieved from pain. So all these goals which you guys have set during the introductory phase, this working phase is the phase whereby you will try to implement these goals. One of the main characteristic feature of this phase is that in this phase, the nurse will be able to overcome her anxieties and the patient fear will also be unknown. So what happens is that, as I've said in the pre-interaction phase, that the nurse may feel anxious that she doesn't have enough information about the client. So even in the introductory phase, sometimes, this anxiousness of a nurse will still be there. Why? Because she still has to gather the information. She may be having a doubt whether the client is giving you the correct information or not, whether she or he is giving you the accurate information or not. But then in this working phase, since they have overcome the barrier of the introductory phase, since they have become acquainted to each other, since they started trusting each other, they've built a good rapport between each other, what happens is that the nurse anxiousness level will also be less, since here she will be confident that whatever the patient or the client is talking to them or giving them the information is the correct one. So as we've seen in the other phase, that the nurse will only be gathering the data of the particular client only from the primary sources like their charts and all. But then in this working phase, she will start collecting information about the patient, both from the primary as well as the secondary source. And after she have collected all these required information, she will try to identify the needs of that particular client. So after she has identified the needs of the client, she will also try to assist the client in order to identify his or her own problem. So how can she, help them identify these problems? She can only help them to identify these problems by having an interaction with that particular client. So here, since they've already built a good rapport with each other, the client will be comfortable to self-disclose himself or herself, and through this way they can identify the problem as well as find an alternative solution for his or her problem. She'll also encourage the client to use the new pattern of behavior as well as help the client to develop a positive coping behavior. So after she has helped the client, she will also encourage the client to use a new pattern of behavior as well as to develop a positive coping behavior. She will also help them to identify their available support system, as well as make them understand that they play a major role in the treatment process. Because what happens here is that no matter how much you're trying to help the patient, no matter what treatment you are providing in order to help them regain their health, if they are not cooperative, then this particular treatment may not be an effective one. This is also the phase whereby they will try to explore the client perception of reality, as well as providing constructive feedback. So here in this phase, when you get an information about the client, when you get to know about their thoughts and feelings, so you'll also get to know about the various perception that a client has. So as a nurse, you must give a constructive feedback whenever it is required. You will also develop and implement the plan of action with a realistic goal. So after you have made a plan and after you have implemented it, it is also important that you must evaluate this plan of action in order to get a result, whether it is helping the client or not. It is also in this phase whereby a nurse will be getting an idea about her strength and weakness while she is interacting with the client. It enables the nurse to achieve the goals which she had planned for this phase. And not only that, by the end of this phase, the patient will be, able to verbalize, socialize, identify, as well as face the problem realistically. So here we have come to the end of this working phase as well. So we have seen that in this working phase, there are various tasks which will be going on and which the nurse need to perform. It is in this working phase that you will be able to implement whatever you have planned for the treatment of the particular client, as well as evaluate the effectiveness of this treatment. It is also in this phase whereby you will get to know more about the patient, as well as you will get to know about your own strength and weakness. This is also a phase where you will be able to help the client not only physically but also emotionally and mentally. Now moving on to the last phase, that is the termination phase. So the final step of this therapeutic relationship is the termination phase. So here in this phase, what happens is that when the nurse has already reached her goals, or when the nurse and the patient has already, met the goals which they have mutually agreed on, then this termination phase takes place. The nurse will discuss the termination phase with the client. She'll also encourage the client to identify the progress that the client has made during that particular working phase. She will also try to explore the necessity of any referrals that may be beneficial to the patient. So here, as soon as both the nurse and the patient have met the goals which they have mutually agreed on, the nurse will not just leave the patient like that. What she'll do is she will help them, to find out their strengths that they have achieved during the working phase, as well as she will also try to help them out in case they need any referral after they have left that particular hospital setting. As separation occurs, it is sometimes common, that the client may be sad, or they may have a feeling of hostility. The client can also try to prolong the relationship. Why? Because he or she will be, having symptoms of a separation anxiety. However, you as a nurse must make sure that you try to terminate the relationship no matter what, because this therapeutic communication or this therapeutic relationship is only meant to, have in this hospital setting and should not continue any further. So as a nurse, you must prepare the client for this termination phase from the beginning itself. So what are the causes of this termination phase? The first cause is referral or discharge. So here, if a client has been referred from one unit to the other, or even from one hospital to the other, or if the client has been discharged from the hospital, then this relationship or communication which both of you have will also come to an end. Or it can be because of clinical rotation, as well as it can be because of the parole which the patient had gone for and it has not returned back. So what are the tasks of this termination phase? The first one is to bring a therapeutic end to this relationship. The second is to review the feelings about this relationship. So here it is very important that you must bring a therapeutic end to this relationship. Not only an end, but you must also try to review their feelings about this particular relationship which you two share. You must also evaluate their progress as well as establish a mechanism for meeting the future therapy needs. So here it is not, just that you must terminate the relationship as soon as the person is leaving the hospital, but it is also very important that you must first evaluate their progress as well as establish mechanism for meeting their future therapy needs. And you must also summarize the entire communication and the follow-up treatment. So this is how you can bring a good therapeutic end to this termination phase. So now here we have come to the end of this topic. So in today's session, we have discussed about the 4 phases of communication. So here we have come to know that there is the pre-interaction phase, the introductory or the orientation phase, the working phase, as well as the termination phase. So we have also discussed about the various tasks that a nurse must perform in each and every phase. So then I hope you guys have got a clear idea of what this is all about. So I'll be meeting you guys in another session whereby we will be dealing with the new topics of this particular unit. So until then, have a good day. Thank you.